On October 1, 1983, the federal government moved to cost-based per day reimbursement of hospitals to DRGs, diagnosis-related groups, essentially revenue per admission based on diagnosis. So think about it for a minute. I was a hospital executive at Stanford Hospital. In September of 1983, what were the incentives financially? Admit and keep the patients. Very simply put. October 1, 1983 with Medicare, admit, keep for 3 days, you gotta have them for 3 days before Medicare pays, and then move on. So in the 80s, we had a reaction to the federal government getting better at controlling its liability. And so business was paying more and business reacted. Does anyone remember the birthday rule? Matt,
you get one a year?
The birthday rule. The birthday rule was...
If both parents have insurance, you use the parent with earlier birthday.
Bingo! Did people hear that?
No.
If both parents, I mean, my husband and I must have been paying nothing for our health insurance because we both had full family coverage for our first 2 children, born in 1983 and 85. That's where the birthday rule came from. Which insurance pays first for the children? Nobody talks about the birthday rule anymore because employers passed on so much of the cost of providing health care coverage that by the end, I mean even by 87, my 3rd pregnancy, ooh, it was one or the other. We're paying too much to have double coverage. So I'm going to fast forward now until the present. A whole host of things happened in the 90s. You know, we had business moving people into HMO products, and then we had what? Consumer revolt, right? Remember those terms? Drive-through deliveries. I didn't have one, I had 7 days. My first week of life was my first week's vacation. But drive-through deliveries and, you know, what do you mean my doctor's out of the network? So we had all these other initiatives, but basically, for a long, long time now, we've been dealing with issues sort of at the fringes, and the situation has gotten worse and worse in terms of people not being able to afford health care, not having coverage being potentially ruinous if you need medical services, and millions of people being uninsured. So, now I will go to my 10 slides. And I've lost my glasses, excuse me. And I apologize, all my people who know how to make things pretty had problems today. Illness, so you just have a lot of verbiage here because I don't really like PowerPoint enough to spend any time learning how to make it prettier. This we already covered. The goals of the Act are twofold. Reduce the ranks of the uninsured, but do it in a way that we don't repeat what happened with Medicare and Medicaid. Where are we in Connecticut? We're doing better than the rest of the country. And Connecticut, I'm proud to say, and you should be proud too, has been a leader in a whole host of initiatives. So as opposed to the national average of 16% uninsured, we have